Okay, that was very upsetting, and there was a little swearing going on. And if it does it again, I don't know what else to do. This is such a piece of crap phone. I will never buy one of these again. And it's not from memory. The other one was because of memory. I don't have any memory on this, so now okay, all right. I'm a little livid. That's gonna have to be my pet peeve. Is every time I buy a phone from Verizon, they just it's I know it comes in a sealed box, but it has to be secondhand because this is what happens. Anyway, vasodilators, they literally dilate your vessels. They cause vasodilation right now. The most common one that I see is hydralazine. You can give it IV or PO. It only lasts about 6 hours or so, 6 to 8 hours, I think 8 hours. So you'll see it usually at least twice a day, sometimes 3 times a day. So when you see somebody on a vasodilator, you know that they have significant hypertension. It's not like, oh, you have a little vasoconstriction issue, and we'll kind of keep an eye on it once a day. This is somebody that if you took that active vasodilator away, they would probably shoot up and it would be pretty rough. So when someone comes into the emergency room with uncontrolled hypertension or hypertensive crisis, that's usually what we'll give them IV in a quick dose and see what happens. When you see these patients go home on it, a little 25 milligram of hydralazine once a day, you're like, okay, that's weird, but all right. When you see 100 milligrams 2 to 3 times a day, you're like, okay, this is a significant patient with crazy hypertension. And what would happen if we didn't give that? Same thing as to where you're going to pay attention to what it does to them afterwards. Do they get real sleepy afterwards? Are you checking their blood pressure? And those are the things that, until you're real familiar with this patient, after I give a vasodilator, I kind of like to go back every so often and check those blood pressures. Now in the hospital, you're going to do that anyway. Vitals are, every hour or Q2 or Q4, so, that's not too difficult. But in these long-term care facilities, until I got real familiar with someone, I would say, I would tell the student, go back and check that blood pressure maybe around noon or so and just make sure that, they're not getting too low, and realizing that, yes, they need a vasodilator, but do they need this dose or do they need it that often? And because of how those medications work, you'll know what to give and what to hold. You walk in there and that blood pressure is 136/62. I may be holding that vasodilator. Now, the good news is we can look up in the computer or in the MAR and we can see when they got it last, and have they been holding it at all, and are they, if I ask the staff there and say, hey, can they tolerate this, vasodilator, this blood pressure? And if they say, like, yeah, give it, or they'll rebound, no problem. Or if they're like, I don't really know, I can always hold it. I can always give it later. I can hold it and see what happens. I'd rather hold it instead of give it and wish I could get it back. So if ever you're curious, if you know, or concerned, if you know how these medications work, you'll know what to give and what to hold. ACE inhibitors, beta blockers, I'll pretty much give them, and very rarely will I hold them. Calcium channel blockers, vasodilators, I may hold those, even diuretics, but for a different reason, and we'll talk about that later. And that's why I'm this 3-minute video. This is so dumb, and now this is going to be how it is. And then what's worse is everyone's going to watch the first one and no one's going to watch the ending, which is fine, because all I have is one more complaint. My sweet little 10-year-old daughter, God bless her, they're honest. Little girls are honest, and just right now she's so disgusted with my existence. The fact that I breathe or pick her up too early. As soon as she sees me when I get her a taekwondo, her shoulders just shrug, and she's just disgusted by me being there, and how come daddy can't pick me up, and I don't know what I did. I'm the one that's buying her things and wrapping all the presents and doing everything, but at any rate, so she tells me, I pick her up early the other day, and she's livid, and as she's moping in the back seat, she stares out the window and she says, "Well, your hair looks ridiculous." And that's her taunt to me. And my response to her is, well, the joke's on you because it's not really my hair. Mm-hmm. All right, guys, love you. Hugs and kisses. Follow your faith. Face your fears. Forget your failures. And this better friggin' work, or I'm going to go in fetal position on the floor. That's what's going to happen. I'm going to go on in fetal position on the floor if this doesn't work. Technology hates me.